Hello everyone. As we all know that following the vicious attack on two doctors at a government hospital in West Bengal, there is a ongoing strike in all over India. And the reason for this strike is the physical assaults or increasing incidents of physical assaults in on doctors in last few years. But these kind of incidents are cannot be allowed to continue. As we don't have any successful act for prevention of these kind of assaults, we have only one failed act, that is the Prevention of Violence Against Medicare Person or the Institution Act, which is notified in 19 states in last 10 years, and this act has failed to address the issues of physical assaults on doctors. Now, as per the data in USA between 1980 and 1990, over 100 healthcare workers died as a result of violence. So these kind of violence are also common in other developed countries as well. So according to a study by the Indian Medical Association, over 75% of doctors has faced violence at workplace in any form. So this figure is quite bigger for our country. And according to the Doctors Protection Act in India, there are punishment of 3 years and the fine amount of 50,000 is prescribed. But the reason for failure of this act are that only few complaints by the doctor or hospital were registered under these acts against patients or the attendants. So number of complaints are very few. Then the those are accused of assaults were punished under this act are very few in number. So these are the reasons for failure of this act. Then the most complaints were not registered as FIR in cases of assaults, or if FIR was lost, then there is compromise between the aggrieved parties. So these are also the reasons for not implementing the act rightly and increasing chances of these kind of failure of this act and increasing number of assaults day by day. Now, what are the reasons why there are increasing chances or increasing cases of physical assaults? First is the role of media, because media is the core agency that spreads different knowledge related to healthcare as well as other uh, areas. Now it has created a poor image of doctors in the mind of the general public. So this is the media, that is the corporate media, that don't understand the medical language, and they keep on spreading the false knowledge and information related to medical profession. Now the lack of faith in judicial process, the Indian population, that is majority is these people are illiterate. They don't have any faith in judicial process. They just want to deal each and every situation on their own. They don't believe in judicial proceedings. Now the mental uh, the mental ability of the mob is not that much developed, or they have just a poor mentality, so they don't have the proper way to deal with the medical professionals because of illiteracy. They don't understand the medical language, they don't understand the basic procedures or the guidelines related to any disease or the any process. Now the poor communication between the doctor or the patient party, this is one of the reason for increasing chances of physical assault. Now, how to prevent these kind of assaults in day by day practice? The first is consent. In each and every cases, one has to take written as well as uh, witnessed consent. The consent should be written as well as witnessed consent, and the proper documentation is also necessary, because what happens in case of emergency, because of heavy workload, there are chances of poor documentation. So documentation is very important step in prevention of various cases of assaults as well as negligence. Now the communication, as we just have discussed, this communication is the important step between the patient and the doctor to communicate information as well as other consequences and the disease process and all related to the condition of that patient to his attendant as well as the patient. So that is going to decrease the chances of physical assault or violence. Now, doctors need to evaluate each situation for potential violence. when they enter a room or begin to relate with the belligerent patient or the relative. So this is very important step to develop a tactic to identify or to evaluate each situation for potential violence. Then it is advisable to look for indicators of violent behavior like staring and the eye contact, the tone or volume of the voice, anxiety, mumbling, pacing. So these are the indicators which has to be identified at workplace. Now, the standard operating procedures must be there at all clinical establishments, and mock drills needs to be conducted, and each member of the staff should be clear about his role if the situation of impending or actual violence does arise. So SOP must be there for each and every healthcare facility to deal with these kind of cases or the incidents of physical assaults. Now, one step is the insurance to ensure the establishment against mob violence or damage to property or to injury to worker, or to at least mitigate the financial losses. Now to remember is do not met anger with anger. Remain calm in the face of provocation or let things blow over. So this is the key of prevention of physical assaults. Now several other important steps are to restrict entry in emergency as well as OPDs. The most important step is in preventing mob violence in the hospital is restricting entry of public. What happens in day-to-day practice that we usually see that there are so many attendants with one patient, and these are the attendants which are going to create violence at any healthcare facility. So there should be restricted entry, only one attendant with one patient. So that should be strictly implemented at each and every facilities. Then entry should be strictly by passes, and this must be implemented through good security, preferably by deploying ex-army personnel or bouncers at each and every gate of emergency as well as OPDs. Now, doctors need to pressurize the government to equate the assault on doctor with the assault on a public servant on duty. So, doctors need to pressurize the government to equate these kind of assaults with the assaults on public servant on duty. Now, there is urgent need for some changes in Indian Penal Code as well as Criminal Procedure Code to have a deterrent effect or prevent future incidents of violence against doctors. So these are some few steps. By following these steps, one can prevent the physical assaults, and there is urgent need of a law that is going to deterrent these kind of assaults or mob violence in various medical facilities, and government is need to implement this act as soon as possible. So thank you guys, and please take care of yourself, and all the best. Thank you.